I do want to introduce our second speaker today. She is the luminary behind Luminary Labs. And one of my favorite things that she did, one of her many accomplishments over the course of her career, was the Human Company Design Playbook that spotlights companies that have taken a human-centered approach to designing their organizations and have achieved business results and by investing in their employees. I saw recently some of her writings on ethics, and I was shaken and inspired. And so I said, Sara, you need to come speak at the conference. And she agreed, thankfully. So please join me in giving a warm welcome to Sara Holoubek.
Good afternoon. I'd like you to imagine a problem that takes the lives of 40,000 Americans every single year and forever alters the trajectory of millions more. Now I'd like for you to consider a solution that is in development. $80 billion has been spent against this solution, but it's still a hypothesis. There's debate about where it is in the development process. If it were a drug, maybe it's pre-trial. Some might argue that it's phase 1 or even phase 2. The problem is we're not talking about drugs, therapeutics. We're talking about emerging technology. When it comes to therapeutics, society, business, humans, consumers, government, we have come together to determine what is the most appropriate protocol to develop a solution. What is a tolerable level of human risk? What are the processes and protocols that we need to embrace and uphold systemically before we put an innovation in the hands of humans who will administer that drug or therapeutic? But with technology, we have none of this. And the speed at which we can come up with an invention and deploy it is so short. We are all still coming to terms with what that ethical framework might be. And right now, with technology like autonomous vehicles, artificial intelligence, voice-enabled solutions, it's all still a hypothesis. Regardless of how many videos you watch or things you read in the news, we're still all testing it out. So how do we navigate this? So my day job is as CEO of Luminary Labs. We're a strategy and innovation consultancy based in New York. Caveat, I'm not a designer. Don't hold that against me. I like to say we work on the thorny problems that matter. And it means things like working with Merck and Amazon last year to understand if voice-enabled technology might be able to help the newly diagnosed with type 2 diabetes. Or whether the blockchain might help us come up with novel solutions to address human trafficking in the supply chains of goods and services. Open data, open and non-traditional data. How might we use it to make our cities safer so that we can identify biothreats before you even know it exists on the subway you're riding? Can we prepare students for the jobs of the future using simulations like AR and VR, as we're doing with the US Department of Education? And for many of our pharma clients, every day we're answering that question: will your organization use data science to kill the pill or make it stronger? And over the past few years, as we were working on each of these types of problems that typically are making use of a novel technology and an age-old problem, we started to ask ourselves questions. What might happen? And it occurred to us that with new technologies and ways of working comes the responsibility of imagining unintended consequences. And in 2018, we are not at a loss for examples. When we think about the potential for wearables to dramatically change how we improve our own health, that's a wonderful thing. That passive data collection is great. Add the social element, and now I've got a buddy who's going to encourage me to run. Hey, if I'm Strava, let's open up the data set and uncover military bases that were not supposed to be made public, which is what happened not too long ago. We all live under our new algorithmic overlords, correct? Right? Data science is going to make the math super fast. But what happens when the algorithm is biased or just decides that you're not a good bet anymore and you shouldn't have health care? Voice technology is near and dear to my heart, and I love this idea of reducing friction by using what humans do best. We talk. We don't type into keyboards at birth. We make sounds. But what happens when voice-enabled technology, the Internet of Things, and artificial intelligence come together? There's a lot of room for error. And yes, the thing is always on, as this woman recently found. So earlier this year, I wrote this piece called The Rise of the Health Tech Ethicist for MM&M magazine. And I was particularly interested in asking executives and government officials and academics and nonprofit leaders, what happens when any data can become health data? I was interested in this idea of digital phenotyping, or the search for digital biomarkers. You know, like the way you type or swipe or tap. It might indicate if you have a disease, or if you're appropriate for a clinical trial, or any number of things, prognosis, if you have Parkinson's. But what happens? How do we navigate the ethical ramifications of looking at that type of data? I was interested in the use of digital tools and devices in clinical trials. What data do you look at? What data do you not look at? What happens to all the data that's collected that you don't want to use? Where does that go? I was also intrigued by research in the wild. This means looking at large treasure troves of Twitter and Facebook data to understand some type of health correlation. And as one lawyer told me, the real problem comes down to how all of this stuff is designed. We live in an era where terms and conditions are the new informed consent. And we know how long you look at those T's and C's before you click yes. So the problem is today, you have a choice. You can talk to the armchair philosophers, that's the traditional ethics path, right? And we've got a lot of those in health, bioethics, ethical advisory boards, or you talk to lawyers, and their job is really to mitigate risk. But in this new era of technology, we need to imagine unintended consequences that go beyond classical ethical training or what a lawyer might be looking at. And so this really consumed me over the past few months. So a few days after I wrote this piece, the Facebook Cambridge Analytica affair came to bear. The Guardian wrote this piece. It was, if you recall, it was like 9 p.m. on a Friday, the news dropped. Bombshell. All of this data about us may have interfered with the election. The very next day, an Uber vehicle killed a homeless woman. And it occurred to me that as a society, we are really not ready for this world that we had programmed. So listen, I'm a technologist. I love technology. But I'm also very concerned that we don't really have the answers yet, that the speed at which we can deploy does not take into account all the things that we would take into account in healthcare. So I wrote this short post. I made it very clear that I'm pro-innovation. And I know the rules. The rule is like never look at the comments. You know what I'm talking about? Okay, I looked at the comments, and it blew me away. I mean, there was everything from people arguing that tech has no place in ethics, and ethics has no place in tech, and that, you know, one person said, you know, of course there will be deaths. There'll be lots of deaths. How many deaths did it take for that pill to arrive? And that one woman, who cares about her? I suggested, well, she's homeless. She's marginalized. Socioeconomics have no place in the development of autonomous vehicles. Other people argued that they do. And some people, the Luddites, were like, let's get rid of all this technology and go back to horses. I don't know what they're doing on LinkedIn, but it was beyond belief. And I could not believe the pushback I was getting. The gross majority of the comments presumed that I was against technology, that I was on the Luddite side, and that there's only one way forward, and that way forward is belief in technology. So since this moment, I'm on a mission, and you're coming with me. You can be pro-tech and pro-ethics. These are not mutually exclusive ideas. And so I'm going to share my 5 tips for you as you go forward as designers or developers or data mavens or executives or CEOs in how you make decisions. So the very first one is read more science fiction. So Mark Zuckerberg very famously said, gosh, you know, when I was developing this platform in my college dorm room, I never could have imagined that Facebook would affect the outcome of an election. And we sort of look at him like, well, maybe you couldn't have then, but you're an adult now. You've got a lot of really important adults, smart adults surrounding you. And you know, shortly after that, they launched this dating part of Facebook. So, I love the science fiction author's take on that. Like, I don't know, like, really, Mark? You think we want to entrust you with our dating life? And, it was interesting because it was the day after the Facebook Cambridge Analytica affair. I was watching the first Incredibles movie with my son. And in it, if you recall, there is an Omnidroid. It's a self-learning robot that basically kills superheroes. It's pretty dark. And then it learns how to kill the next stronger superhero. And it systematically goes through the superheroes until it is like the most powerful thing. So if my 5-year-old can imagine this, why can't Mark in his dorm room? So I work with some, arguably, like, I will say, pro-liberal arts folks, but we took this to task, and we curated a list of 100 works of fiction that every technologist should read. We narrowed it down to 40. These are the 40. You can go to the Luminary Labs website and go to the lab report, and we've detailed out, what you should read, what you should, we're talking science fiction, of old, as well as VR experiences, TV shows, movies, et cetera. We really need to stimulate the imagination by reading what we already read today and that 5-year-old children pay attention to, and apparently tech executives do not. But it's not just about an argument for liberal arts. Organizations like the Lowe's Innovation Lab are using speculative design to bring scientists, researchers, designers, writers, and filmmakers together to better understand this connection between humans and technology in the future. There are other organizations that are doing this, like ASU as well, and the Design Futures Initiative. Tip number 2, get to know the tech ethicists. So I started this a little bit earlier by saying, like, you've got these armchair philosophers sitting with their lapdog by the fire, and then you've got the lawyers. But there are actually a lot of people out there who are working on this type of thing. And so I made a Twitter list. I just started it. If you've got a recommendation, send it my way. Or you can also follow this list. And so we're talking about people like Camille Nebeker at UCSD and her work in helping IRBs and researchers understand what is possible and should be possible. It's people like Ifeoma Njunwa, who we chose to be a judge on the Alexa Diabetes Challenge we ran last year because we wanted to make sure that a juror had an ethical background, not just a tech background. Tristan Harris, he's been fighting for the design of smarter tech that takes into account mental health and the societal outcome. Or Natalie Evans-Harris, who was previously in the White House and who is working on an entire code of ethics as well as curriculum for designers, developers, and data mavens. The third point, we talked about a designer's oath earlier, is to take another oath. There's lots of oaths out there these days. One that you might have seen is the Code of Ethics for Data Scientists. So again, this was the brainchild of DJ Patil, who is the first Chief Data Officer of the United States of America. He worked with Natalie Evans-Harris as well as other individuals. And the principle is pretty basic. Like the Hippocratic Oath, which says do no harm, shouldn't data scientists do the same? And how might they think about this and hold each other accountable to these principles of ethics? And so you can make an oath, you can take an oath. They're popping up everywhere. I hope at some point we all have a common shared oath. The fourth, and this is one of my favorite, is a term that I have borrowed from Laura Noren, who was at NYU and actually taught data ethics. She's now at a cybersecurity firm. And Natalie Evans-Harris, who uses this extensively as she educates. What we need to do is spur the ethical imagination. If you need to consider what might be considered an unintended consequence, you have to start with what is possible. And so very recently at the Personal Democracy Forum in New York, Natalie gave a keynote on imagining unintended consequences. She followed it up with a workshop that I participated in and helped facilitate, where each table came up with a case study. So imagine a project you're working on right now. Whether you're a designer, developer, data scientist, executive, think of a project that is making use of an emerging technology. Maybe it's never been done before, or there are very few examples. Now imagine you get everybody on your team, those above you, those below you, those to the right, those to the left, get everybody in the room and ask yourself these questions. What might we want to take into account as we collect data, as we store data, as we clean data? Is there an opportunity for bias to come in? Is the way we are feeding the machine maybe even more important than the machine itself? What could we do differently if we were asked to design this around a common set of principles? So I pulled a few of the questions. She has an entire framework. If you're interested, you can hit me up and I'll share that with you. It's a 2 or 3 sheeter that you can go through, and I highly recommend you do this. I chose a project that we had completed, and I asked this group of individuals, none of whom who had worked on this project, how they might approach this problem. And I was really impressed with the solutions they came up. They were things that I never could have imagined. They had spurred their ethical imagination by sitting down together and just simply asking each other questions. My last tip is to join the community. So right now, ethics is pretty much limited to headlines, questions, what is right, what is wrong. It's a very divisive topic. The first death by autonomous vehicle is just the first death. 40,000 people die every year at the hands of human-driven vehicles. But we need to come together and we need to have these discussions about how we design and develop this technology before we deploy it, or as we're deploying it, and as we're proving out the hypotheses that, yeah, humans are probably worse drivers than robots, but how do we design the system to take into account what the other trade-offs might be? And so there are communities sprouting up everywhere. CORE is the platform designed by Camille Nebeker, the tech ethicist I mentioned earlier. She's at the University of California, San Diego, and she has created an open source platform where researchers and scientists, academics can submit their IRB package if it included some device, so whether it's a camera, some type of tracking, anything that would collect what she calls missed data, mobile imaging, sensing, et cetera, and talk about what got through. What was the pushback? IRB members can look at this. There's a community, so that we now will have set of case studies, examples, precedent of what is acceptable in a study. Patrick at Duke will also make the argument that collecting these case studies is really important. The amount of data an individual is willing to give up is often correlated to just how sick they are. Your desire for privacy oftentimes goes out the window the closer you are to near death. And so these are the types of things that we need to think about when it's data deciding whether you get the treatment or not. A traditional ethicist might not have the solution, nor will a lawyer. So we need to curate these examples. Another one is the Center for Humane Technology. I mentioned Tristan Harris and his team. So these are former Facebook and Google and Twitter, et cetera, executives that came together and they decided that everything they built was not designed with the best intent for humanity. And they're making a very strong argument that the commercial model behind these platforms is simply to get you hooked. And when we get you hooked, you become addicted to the technology, you don't spend time with humans, you don't connect with each other. And they are on a mission to get designers in particular, that was their first initiative, to think about how you're designing these platforms or the apps that sit on top. And last but not least, Slack. I have a love-hate relationship with Slack, I will say that. But when I do stumble across a Slack channel that I really enjoy, it is things like this. It's not just an ethics conversation, it's ethics for content, right? So think about that. Ethics for content, ethics in design, ethics in data science, ethics in business planning, ethics in financial decisions. I'm a strong believer that no matter what your role is, you have a seat at a table. You have a seat at a table today. Tomorrow you'll have another seat at the table here. And then when you go back to your office, you'll have a seat at another table. Maybe it's in a conference room, maybe it's in a boardroom, maybe it's at your dinner table. And regardless of what your job is, you don't need to be the CEO or board of directors member to do this. Every single decision you make is an opportunity to lift humans up or to push them down. And so I want you to think about that as you design this next generation of health solutions that do embrace technology and they embrace all that we have learned in this very short period of time over the past 15, 20 years, to think about what is the worst possible thing that could happen and how can I design to make sure that is not what happens when it is delivered and put into the hands of real people. So I want to thank you, and I wish you the best in your ethical ambitions, inspiring your imagination.